Welcome to the Deep Dive. Today, we're jumping into a book that's really making waves. It's John Green's 2025 nonfiction release, Everything Is Tuberculosis.
Right. And it's not what you might expect just from the title.
Exactly. You hear tuberculosis, maybe you think dusty history books.
Or old movies, yeah. Sanatoriums.
But Green takes it somewhere else entirely. It's part emotional journey, part history lesson, and really, really personal.
A memoir element, too. It's quite a mix.
Definitely. So our goal today is to sort of unpack why this book is hitting so hard, what makes it feel so important right now.
Well, a big part of it, I think, is how he immediately tackles our assumptions. We tend to think of TB as, solved, a thing of the past.
Right, like polio or something.
Yeah.
Something we vaccinated against and moved on from.
But Green lays it out starkly. Tuberculosis is still one of the world's absolute deadliest infectious diseases today.
Yeah, that's the first big shock, isn't it?
It really is. It makes you stop and think about what else we might be wrong about, health-wise, globally.
So how does he do that? How does he make this old disease feel so urgent and current? It's not just stats, right?
Oh, not at all. He's a storyteller, first and foremost. He weaves together really vivid personal stories, deep historical context, and the actual science. For instance, he gets into the biology of it, the Mycobacterium tuberculosis.
Okay.
Explains how its structure, its sort of waxy outer layer, makes it incredibly tough to kill.
So that's why the treatments are so difficult.
Exactly. It helps you understand why progress has been so painfully slow over centuries, really, and why the drug regimens are often so long and grueling.
Months, sometimes years, right?
Yes, and often with multiple drugs that have serious side effects. And then there's the social side. The stigma.
Which he says is still a huge problem.
Huge and deeply tied to inequality, to poverty. It's not just a medical issue. It's woven into the social fabric in many places.
So it's connecting the biology, the history, the lived experience.
Precisely. And he uses that to talk about much bigger things.
Like what? What are the broader themes he's getting at?
Things like, global healthcare access, or rather, the lack of access for so many. He connects TB directly to global poverty, showing how they often fuel each other. And he forces us to look at how we as a world respond or fail to respond to widespread suffering, especially when it happens far away, or to marginalized groups.
Are there specific facts or numbers he uses that really drive that home?
Oh, definitely. The fact that TB still kills more people globally than HIV/AIDS, for example, that often surprises people.
Wow. Yeah, I wouldn't have guessed that.
And he highlights how it disproportionately hits communities already struggling with poverty, lack of resources. It really makes you rethink what constitutes a global crisis.
In this sense of overlooked suffering, it connects directly to his own experience, doesn't it? That's a huge part of the book.
Absolutely fundamental. He's not writing this from some detached academic viewpoint.
Right.
He writes as a patient, someone who lives with chronic illness themselves.
Right. His own health issues.
And that seems to give him this profound empathy, this connection to what TB patients endure. The long timelines, the uncertainty, the physical and emotional toll.
So it's less clinical analysis, more human testimony.
Exactly. It makes the book incredibly raw, very human, and honestly quite heartbreaking in places.
Yeah.
But that vulnerability, that personal lens, is what creates this this dawning realization for the reader.
What kind of realization?
Just how invisible some diseases are, especially the ones that primarily affect the poor. You read it and you think, how did I not know this? How did I not see the scale of suffering?
It's that aha moment, but kind of a horrifying one.
It is. It challenges your perception of the world, really.
So, okay, it's more than just a book about TB. It feels like a challenge, a call to action, almost.
I'd say definitely a call to attention, at the very least. Pay attention to these crises we prefer to ignore.
How does he frame that? What's the argument he's making beyond just, here are the facts?
He argues pretty compellingly that global health isn't just about finding new cures or, scientific breakthroughs. That's part of it, sure. But it's fundamentally tangled up with compassion, with effective, equitable policy, with social justice.
They're not separate issues.
Not at all. He shows how they're completely interconnected. You can't solve the medical problem without addressing the social and economic one.
Which speaks to the power of how he wrote it, right?
Yeah.
It's nonfiction, but it reads differently.
Totally. It's a perfect example of what nonfiction can achieve when it's written with, the heart and the craft of a novelist.
Yeah.
He takes these huge, complex, sometimes, frankly, depressing topics and makes them accessible, engaging, human. That's his signature, really.
And anyone who's read, say, The Anthropocene Reviewed or Turtles All the Way Down.
Yeah.
You recognize that voice immediately.
Oh, absolutely. It's thoughtful, it's vulnerable, but also incredibly sharp. Brilliant, really.
He has this way of making you feel like you're thinking alongside him. It's quite intimate.
It is. And because of the weight of this topic and how he handles it. Everything is... Tuberculosis might actually be his most important book so far.
That's a big statement, but reading it, you feel that weight. It really challenges you.
It does. It makes you question how we engage with suffering that isn't right in front of us.
So maybe that's the thing to leave people thinking about after reading this, or even just hearing about it now. What is our role, individually or maybe as a society? How do we get better at seeing these quote-unquote invisible diseases, this suffering that continues?
Yeah, and maybe how does understanding history, like the long, complicated history of TB, actually equip us to act with more compassion, more effectively right now?
A lot to think about. It's a powerful book.
It really is.